Good evening, sir.
Am I allowed to point out people? Oh, I'm sorry. Did I jump over somebody? If you don't mind, he was next. I'm sorry.
Good evening, sir.
I'm sorry. I didn't mean to jump over.
No problem. Thank you for your service in the military.
Same to you.
And you are public servants. I have been a public servant my career. Thank you for your service to the military and your service as a legislator. You're a true patriot of the 21st century. I have 3 questions related to the plan specifically. I lived in the center city here, Philadelphia, in 2005. My stepfather, was a Marine veteran, Korean War. My biological father was a Vietnam Navy veteran. I'm here from out of town. I have a confession, I'm from Boston Red Sox country. I'm returning to Philadelphia in the fall. The top 3 patriots in my book, not New England patriots, are Paul Revere, John Adams, and John Quincy Adams. Paul Revere was the first health officer in America, the president of the Boston Board of Health. John Adams created the United States Public Health Service in 1798. And John Quincy Adams. My question today, I was over at City Hall. Morning breakfast, I stayed at a local hotel. Came in from a funeral from Boston, my friends.
All right. Go ahead. Please let me finish.
All right, my question, I know everyone wants to ask questions. The homeless people, they have
The what people?
The homeless.
Homeless, yes.
They have nothing. No health care, nowhere to live, little resources. At City Hall today, I bought a few homeless men a cup of coffee, a donut, and a lottery ticket, since Pennsylvania won 86 million. My question is, what's in this bill for the homeless? Number
Absolutely.
1. Number 2, my stepfather, Alzheimer's 2005. He died of Alzheimer's. 3, the veterans of 9/11. I served at Ground Zero for a month after the Pentagon on 9/11. What's in there for the veterans? The civilians of the Department of Defense, those that have developed post-traumatic stress.
Yes, sir. Let me thank you very much. And this is a great. If I could, we had this discussion before we came up here. I want everybody to understand why he's asked this question about the homeless. 1 out of every 4 homeless today is a veteran. Can you believe it? Yep. And why he asked the second question is our Iraqi and Afghanistan vets are showing up on the homeless list more quickly than Korea or Vietnam. And here's why, if I could, just because this is such an important point. Our World War II vets were heroes. It was the world's greatest generation. They did about 182 days of combat. Horrific combat you'll never see again, hopefully. But there was some dwell time in between those great battles. Your soldier, Marine, in Iraq, goes outside the wire every day, 24/7, for 15 months, comes home for 12, goes back to 24/7. That's why in the active force, 22% come back with PTSD. It's unrelenting. They're as strong as any generation. It's a different war. And 32% of all our National Guardsmen and women come home the same. This is an illness that is feeding into society. I have been to the VA hospital right here in Philadelphia 5 times in the past 5 months, to address this mental health issue. Now, how are we dealing with it? The homeless first. We cover up to 400% of poverty level for those like you often see here, so that they can afford to get into a healthcare plan. Why? There's a doctor may I speak of it? A doctor is doing a study right here that is looking at those and the pride. I mean, you should see people who come here. They are proud men and women. And what is the impact on them and all? And some of the doctors come here and say, my God, they're ticking time bombs. Who's their general physician? I'm sorry, they don't have a general physician because they can't afford it. And so they're not a productive citizen as they could be. So that's why we cover 400%. Everybody up to poverty level. Second, vets. In these 38 summits, first of all, we are keeping the VA system whole for them, as well as the military tri-care system, and the bill legislation says that. Number two, in 2003, we kicked out of the VA what's called Priority 8 veterans. Those that made just over approximately, Billy, 28,000, they just said no more. About 265,000 vets were denied it. 28,000. So last year we got a piece of legislation through that covered 15% under a pay-go for $375 million to get them back in. And under President Obama's budget, under his budget, all of them are covered. It's going to take us following years together. Third, post-traumatic stress disorder. This is an area, this is the signature issue of this war, along with traumatic brain injury, and they go together. What we've done is we have increased the VA bill, hard money, last year and the year before. The first 2 years I was in Congress, $3.3 billion, not authorized, appropriated, handling almost exclusively mental health. But this bill for everybody, including any former vet, has mental health parity in it. So, I'm sorry, we talk on vets because they serve us. And after Vietnam, I'm sorry to say we kicked them to the side of the curb and never again. My take on this here's what we do. For anybody, if you have a mental illness, which is the largest disease in America, 23 million Americans suffer from it. What it says is no longer are there permitted to be any higher co-pays or premiums for mental health treatment. And you get the same amount of visits as if you got a leukemia or a broken bone. You cannot limit it to any, and that is because we are a much more productive member. He or she a productive member of society. So if we get the treatment early, before, unfortunately, they come home, and if you've seen many do it, they get involved, nothing to do, they're coming home in a recession, they get involved in drugs or alcohol potentially because there's no jobs, and that's why they have to have that treatment. That's what the bill does. Thanks for the question.